Let's talk about Valium. Or diazepam. What is it? It is benzodiazepine. Oh, misspelled this. Sorry. Benzodiazepine. How does a benzo work? Its method of action is it binds to type A GABA receptors. Causing sedation. So, with that being known now, what things do you think we would be using? What indicators would we use to use Valium? It causes sedation. Well, we're going to use it for anxiety. We're going to use it for seizures. And we're going to use it for muscle relaxing. So anxiety. You get somebody in a severe anxiety attack. They're hyperventilating. They are, fingers and toes are curling. They're blowing off all their CO2. Their end-tidal is down in the 20s. And you just can't coach them out of it. You cannot coach them out of the hyperventilation, out of the anxiety attack. This is something that we can use. Valium is commonly prescribed for people with panic attacks or anxiety attacks. It is a very useful drug. It can be abused, of course. Primarily in the pre-hospital field, we are going to use it for seizures. We are going to use it for status epilepticus, unbreakable seizures. We are going to use this in that respect. The muscle relaxant, okay, you come in with back spasms, come to the emergency room or to the doctor or something like that, and you have chronic back spasms or such similar things, you may also be put on an oral Valium, or you may be given an IV IM at the hospital to kind of help break those spasms up and to relax that for the back pain and increase mobility. Our dosing is 2 to 10 milligrams. And that can be given IV, IO, IM, PO, and rectally. Valium carried in the hospital in pill form and in IV form or liquid form can be given, or well, pill form obviously is orally, the only way you're going to take it. Liquid Valium or IV Valium can be given IV, IM, PO, or rectally. IO, yes, it can be given IO, but are we going to give it IO because that patient is probably already unresponsive? Probably not. Nor are we going to drill into an actively grand mal seizing patient. I doubt it. However, if that's the route you take and you're able to start an IO because you cannot start a line, that's a good way to give. Rectally is generally going to be given the most. This does come in a gel syringe with a rectal applicator, and those you're going to find in your special needs group homes or in private homes of parents that have a child with epilepsy or something like that. It's a large syringe with, again, a rectal applicator to slide into the rectum, and it's a big syringe, and they shoot the gel in there and it's absorbed through the mucosa in the rectum. We in the field don't carry that. So in the pre-hospital setting, you're going to use the IV dose. You're going to use an IV catheter. And that can be screwed onto the end of the syringe and inserted into the rectum, and you can give the liquid medication directly that way. Of course, you're going to remove the IV needle from the catheter. You're going to use only the catheter. And generally you can use an 18 gauge or a 14 gauge to do this, or a 20 gauge even for that matter. But you want something with a little bit more length than the 22s and 24s. So we're going to give seizures. You should have standing orders. Anxiety most likely is a call-in order to the hospital, to medical control. You may have standing orders for that, and the muscle relaxant, again, that'll most likely be a call-in type order to medical control and get a verbal order directly from the doctor. Our contraindications for giving Valium is going to be allergy. Allergy to the med. Only real contraindication to it. Some of our side effects, adverse reactions, are going to be hypotension, which you would figure since it is a sedative and it is going to cause relaxation. Sedation, amnesia, nausea, vomiting, and respiratory depression. Okay, so knowing that this is a sedative, what other possible uses are there? Sedation for SVT is a possibility. For cardioversion, synchronized cardioversion is where you might possibly see this used. There should be standing orders, depending on your department and where you are, as to what sedatives they want you to use or what pain control they want you to use. But this is a possibility. Other things you want to think about, it is not water soluble, can cause irritation to the site, injection site. If you're giving it IV, it can hurt. If you push it fast and push it hard, it can hurt. It is corrosive to or caustic to the vein, corrosive to the vein, however you want to talk about it. And it can be reversed. However, we generally do not reverse